Hello, this is Dr. Steele. Today I want to talk to you about one of the most important symptoms that you need to identify, especially if you have diabetes, and that is hypoglycemia. Hypoglycemia. That means low sugar. And as you already know, the most common reason for that to happen to us is because we're taking medication for our diabetes. And sometimes those medications can overdo its job, or because we didn't eat after taking the medications, which we should be very careful about that. But it's important to recognize those signs and symptoms because it can lead to, unfortunately, death. Remember also that even though high sugar, high blood pressure are important for the long run, for your longevity, low blood pressure, low sugar can actually lead to a problem today. In other words, high is dangerous for the future. Low is dangerous for today. So it's important to recognize those signs and symptoms. And we have an acronym called, tired. You can have the following because when that happens, when your sugar levels are low, your stress hormones are going to be released. And those stress hormones are going to make you have a high heart rate, could, a irritability, you're like, I don't feel good, restless, you're desperate because something's off, excessive hunger sometimes, and of course, sweating because your autonomic nervous system is overreacting. And the point here is one of the symptoms is you start shaking. If you get the shakes, we need to address that. And it's important to recognize that not only you need to be aware of that, but also your loved ones. Because if you're by yourself and you don't have the strength because you're tired, because sugar is very low, and your body doesn't have the energy to be able to act, they or you need to have a plan of action. And it's important to have, and I do recommend for my patients because not only do we want to elevate your sugars, but I also want to elevate my proteins because the proteins can be turned by your liver into sugars. So I recommend for you to carry or to have around your house. Have you ever been to a convenience store and they give you the creamers, like hazelnut or vanilla for the coffee? I think those things are very valuable if you have them handy because you can open them up, drink them, two of them, and you're going to go back to normal almost, and then you're going to go eat something. So remember, hypoglycemia is more dangerous than hyperglycemia today. So from now on, you need to have a plan of action, talk to your doctor, talk to your provider to figure out ways to identify low sugar and how to treat it, as well as if the medication that you're taking needs to be adjusted. Because as we grow, things may change, and medications that we're doing as good in the past may not be as good in the future. So that's my talk for today. Take care of yourself. Remember that, and remember always that the greatest wealth is health.